Back everyone Between Bells, in this segment brought to you by SmileDirectClub, helping you get a smile that you'll love for less with a lifetime smile guarantee. Now, your dental health plays a critical role in your overall health and also your well-being. But access to dental care isn't an even playing field, and there are a lot of gaps across the industry. So joining us now to discuss the disparities in the dental care industry and what solutions are out there is Dr. Amira Ogunleye. Dr. A, such a pleasure to have you here. Thanks so much for joining us. So how important is diverse representation when it comes to the dental industry?
Well, thank you so much for having me. I'm happy to be here. Representation is so important. You know, we can't be what we can't see. So it is important for young boys and girls all over the world to see a reflection of themselves, you know, in the spaces they can fill. As a Howard University graduate and a dental professional, I have also seen firsthand how representation plays a huge part in equitable access to care. You know, I recently teamed up with SmileDirectClub because we share a deep-rooted passion for making a difference. You know, we are trying to create more minority leaders. We are actively changing the ratio. They have a scholarship that they've joined with National Dental Association to provide for minority dental students, because we understand that this is the way we really get to the underserved communities. So it's been work, but it's been amazing.
And I'm glad you're having this conversation with me about this. I'm curious, what are some of the big barriers a lot of people face when it comes to getting dental care here?
Access to care. You know, this is a story that I'm just too familiar with. I was born in Egypt, and when we immigrated to this country, a visit to the dental office or an orthodontist, that was not a luxury that we could afford. Let me just bring this to your attention. The average cost of braces is $5,000 to $8,000. Financially, that is out of reach for a huge percentage of the population. And if we even take it a step further, 60% of counties in this country don't have an orthodontist office. So now we are dealing with a financial barrier as well as an accessibility barrier. So we need change. You know, we have to have change, and minority populations are being affected the most. They are impacted the most. We have to think about the lower income bracket population because they are the ones that are feeling this at an unproportional level.
Absolutely. And sort of the new part in all of this is teledentistry. How does that make dental care a lot more accessible here? Is it because a lot of people have the ability to just log on and be able to talk to somebody finally?
That's exactly it. It's the access. You know, patients can reach their doctors right then and there. And when we think about the working family, you know, who perhaps would have to take a day off of work to bring in their child or to go in themselves, well, that costs. And again, a lot of people cannot afford that cost. So telehealth in 2020 was up 335% due to COVID. So we're also understanding the safety with this, you know, limiting so many interactions, getting the access to these people. So I think it's on the rise, and I think it's going to continue to be on the rise.
Dr. A, what options are currently out there to sort of level this playing field when it comes to oral health care? Are there any options out there?
Yeah, I'm glad you asked. Telehealth, like we just discussed, that's huge, right? Because we are now reaching people who potentially we couldn't reach before. Companies like SmileDirectClub, who are standing by their motto that everybody deserves a smile they love, and barriers such as cost or convenience shouldn't be factors. You know, they have been able to reach a demographic, right? And be able to provide straightening solutions to them, to a demographic that would not have access. And that's huge. And ultimately, it's about people caring, you know, people who have the platforms and the voices and the ability to make change, stepping up and understanding that we have to do more for underrepresented communities.
Absolutely. So how does sort of dental health tie into the overall health and well-being for a lot of people? I mean, I think maybe the point I want to drill into a lot of people is, why is dental health so critical here for people?
You know, it's interesting because I think people are very surprised to learn how much dental health plays a part in overall health. So, dental disease is linked to diabetes, kidney disease, heart disease, even cancer. So, after a year of such heightened stress, limited social interactions, I believe that we are becoming just more in tune with our personal health. We're taking control of that and we're understanding how important it is to really remain healthy. You know, consumers are reporting that they spend a significant more time on their oral hygiene in 2021 than they did in 2020. So, as a dentist, that is a big plus for me and a great step in the right direction.
Such a pleasure to have this conversation with you. Dr. Amira Ogunle joining us here on Cheddar News. Thank you so much. And guys, see what people are smiling about over at SmileDirectClub.com.